I want to tell you about a circumstance where understaffing led to negative patient outcomes. I want to talk about a code blue on a medical floor where there were 4 nurses on shift. And traditionally, this floor would have seen about 6 patients per nurse. In this circumstance, each nurse had 10 to 11 patients. This patient was assigned to an RPN. The patient had a complex history, was 9 days post-op from a surgery with serious potential complications. The patient coded only minutes into the nurse's shift. The staff pulled the call bell, and it took greater than a minute for other staff to respond on the unit. Everyone was short-staffed, right? Everyone was busy. Multiple staff came from other units to help, but they realized in doing so that they left their own units short, and some had to return. It took 4 nursing staff to lift this patient onto a bed in order to provide life support and life-supporting interventions. Any one of these nurses could have been hurt in that process of trying to move this individual without proper lifting equipment. These nurses did advocate for this patient. They told the supervisors, the nursing supervisors, that this was not an appropriate patient for this unit, that in no way this patient should have ever been on their unit, that it should have been transferred to a more appropriate location for that level of care. A workload review form it's a tool, and we teach that it's a tool to provide you with an opportunity to advocate for the current situation that you're experiencing. But on top of that, it's protection. Like, your workload review form is protection. And I think that all of our nursing staff need to attach it to the same mindset as your PLP insurance, right? You have your professional liability protection insurance that's attached to every nursing staff. We have a requirement to carry that. And we need to change the mindset that you have a requirement to fill out these workload review forms every single shift where you have a circumstance that tells you that this workload is not okay, that tells you that this workload puts you in a circumstance where you could be held professionally liable. And in that circumstance, when you're filling out those forms, it's telling your employer that you're not okay with these circumstances and that you recognize that these circumstances do not allow you to do your job appropriately or properly. So I think we need to change the mindset when it comes to workload review forms, and we need to give it a little bit more teeth in these circumstances. And how I look at doing that is by attaching it to our incident reporting system within our organizations, attaching it to our WSIB component, and when it comes to reporting unsafe work conditions. So one way that we can do that is by engaging our incident reporting system within our organizations that tells the organization on a joint occupational health and safety level that these circumstances are not okay. So it's taking it that one extra step further. It's engaging a different level within the organization that prompts them to investigate. Because as nurses, we're limited on our ability to refuse unsafe work, but we're not limited on our ability to identify it. So we need to be identifying that these circumstances are not safe. They're not safe for us. They're not safe for our patients. And we need our employers to take action. And we need to push them in a circumstance into a direction where they have to appropriately investigate that. So unless we continue to identify these workload issues, what's going to change? We have to make that change. That's our job.